And the continuation of infectious medicine, today I will discuss pneumonia. So first of all, we should know how we can define pneumonia. So we can define pneumonia as it is the inflammation of lung parenchyma, right? So pneumonia is the infection of the lung. The patient with pneumonia presents with fever and cough with purulent sputum. So whenever there is a fever, whenever there is a productive cough, so first of all you have to go for chest extra, and when you do chest extra you will see the consolidation. Now these are the classical features of the pneumonia, that is, if there is a fever, if there is productive cough, and if there is consolidation. So these are the classical presentation of the pneumonia. So if there is fever, if there is productive cough, so first of all you should do the chest extra. Along with that you have to check the oxygen saturation. Because there might be hypoxemia as well. So you can do chest extra, then you will check the oxygen saturation, and then you will look upon the hospital admission. You will see the hospital admission. Now if the patient got admission in hospital before, so in that condition the criteria is different, and if there is no admission in hospital, so in that condition that is another scenario. So if the patient doesn't got any hospital admission before, so in that condition that is called as community acquired pneumonia. If the patient got pneumonia within 42 hours of hospitalization, meaning the patient got admission before for some other illness, but after that patient developed fever, productive cough, and consolidation. So if the patient got pneumonia within 42 hours of hospital admission, so that is called as hospital acquired pneumonia. Causes of community acquired pneumonia. So the most common cause of community acquired pneumonia, that is viruses. So viruses is the most common cause of community acquired pneumonia. But if I talk about the most common bacteria cause, so the most common bacterial cause of community acquired pneumonia is Streptococcus pneumoniae. And there might be Mycoplasma and Chlamydia. Mycoplasma and Chlamydia, it causes community acquired pneumonia in healthy and young individual, and together these bacteria are called as atypical bacteria. Why it is called as atypical bacteria? Because it do not show the gram staining in culture, and these atypical bacteria, it causes the atypical pneumonia. Atypical pneumonia is sometimes called as walking pneumonia, right? So what are the other causes? Haemophilus influenza can cause the community acquired pneumonia, but most commonly in COPD patients. Staph aureus cause the post-viral infection. So if the patient had viral infection, so after that there is a highly risk of infection of community acquired pneumonia by Staph aureus. Also there is Legionella. So Legionella can cause community acquired pneumonia mainly in old age patients and the immunocompromised patients. Causes of hospital acquired pneumonia. Hospital acquired pneumonia, it is mainly caused by resistant bacteria, and those resistant bacteria are Pseudomonas, E. coli, Klebsiella, MRSA, and VRSA. Let's talk about the investigation of pneumonia. So first of all, the best initial test is chest X-ray. chest x-ray, it is the best initial test of the pneumonia, and it will tell you the type of pneumonia. At the same time, it can tell you the severity of pneumonia as well. There are two findings, that is lobar infiltrates. Then you can see lobar infiltrates, and you can see the interstitial infiltrate, right? So and the lobar infiltrates, it involve the lobe, it involve the one lobe, or it involve the more than one lobe, like it involve one lobe or it involve more than one lobe, and it is mainly caused by streptococcus pneumoniae. It is caused by streptococcus pneumoniae. It is important. Or another hand, if I talk about interstitial infiltrate, in interstitial infiltrate, you will see that there is patchy infiltrates all over the lung. So the patchy infiltrate, it is distributed in all the fields of the lung, and it is mainly caused by which organism? It is caused by Mycoplasma, Chlamydia, and Legionella. Gram staining, sputum culture and gram staining might be helpful, and that sample should be taken before starting antibiotic therapy. And if you do the sputum culture, then you can see the color of the sputum as well. So if there is rusty color sputum, so that is caused by which bacteria? That is caused by Streptococcus pneumoniae. But if there is carangelli like sputum, if you find carangelli like sputum, so that carangelli like sputum is caused by which bacteria? That is caused by Klebsiella. By seeing the color of sputum, we can think about the cause of the pneumonia, right? So it's important. Now we can do the serum procalcitonin level as well. So we can do the serum procalcitonin level. Now serum procalcitonin level, it is mainly raised in bacterial infection. Though it is raised in viral infection as well, but most commonly it is raised in bacterial infection. You can do the CBC as well, and you can do the ABGs as well, mostly in severe pneumonia. In severe pneumonia, there might be hypoxemia. So there will be carbon dioxide retention, which lead to respiratory failure. So you can do ABGs as well, and you can perform the another test, that is HIV test, if the status is unknown. If the status is unknown, then you can do the HIV test. Also, the most specific test is the open lung biopsy. So, theoretically speaking, the most specific test for the pneumonia, that is open lung biopsy, meaning you have to open the lung and then you should take biopsy, but it is usually doesn't perform. So what is Q-SOFA criteria? Actually, this criteria, it is done in emergency situation. It only differentiate the high risk patient of pneumonia to the low risk patient of pneumonia. So in the Q-SOFA criteria, there is certain features like the respiratory rate is more than 22, so there, that is 1 point. If there is altered mental status, so that is the another one scoring. While if the systolic BP is less than 100 mmg, that is 1 point. So if the Q-SOFA criteria is more than 2, so in that condition you have to provide the ICU care. So mainly the Q-SOFA criteria, it tell you the ICU admit. Now curve 65 criteria is the specific criteria for pneumonia. It indicates the need of the hospitalization. So in the curve, that C stands for the confusion, U stands for uremia, where blood urea nitrogen value is more than 20. R stands for respiratory rate, that is more than 30, and BP is less than 90 by age is more than 65 year. So if you see these features, every feature got one scoring. So confusion got one score, and each of these feature it got one score, right? So if the curve 65 score, if the scoring is between the 0 to 1, so that is considered as mild pneumonia, right? If the curve 65 score it is lies between the 2 and 3, so that is moderate pneumonia. And if the scoring of curve 65 it is more than the 3, so that is severe pneumonia. By applying the curve 65 rule, so the community acquired pneumonia it is divided into mild pneumonia, moderate pneumonia, and severe pneumonia. So in mild pneumonia the curve 65 score it is lies from 0 to 1. So in mild pneumonia you have to give the azithromycin with doxycycline with the dose of 200 mg and loading dose, then 100 mg per day for 5 days. Or the another option is you have to give the clarithromycin 500 mg per 12 hour if the patient is resistant to certain antibiotics. In that condition you have to give the moxifloxacin. While if I talk about the moderate pneumonia, in moderate pneumonia the curve 65 scoring will lie 2 to 3. So in that condition you have to give the amoxicillin with the dose of 500 mg per 8 hours with clarithromycin 500 mg BD, or you can give doxycycline with the dose of 200 mg as a loading dose, and then 100 mg BD. But there are certain alternative agent as well. So as a alternative agents you can give the moxifloxacin as a monotherapy, or you can give the third generation cephalosporin. Along with that you can give the azithromycin. While if I talk about the severe pneumonia, in severe pneumonia you have to give the respiratory fluoroquinolones with third generation cephalosporin, or you can give ampicillin and sulbactam. But if the patient is resistant to fluoroquinolone, at that condition you can switch to azithromycin. Acquired pneumonia it is caused by Pseudomonas and MRSA, right? So it is caused by Pseudomonas and MRSA. As you know that these are the resistant bacteria, so you have to give the stronger antibiotics. So you can give the piperacillin and tazobactam, and you will give the linezolid. So what happens that this piperacillin and tazobactam it will kill the Pseudomonas, right? So Pseudomonas is killed by piperacillin and tazobactam, while the linezolid will kill the MRSA. But if there is resistant condition, so in that condition you have to give the certain alternatives as well. So in place of piperacillin tazobactam you can give the carbapenem, and in place of linezolid you can give the linezolid.